All right, let's talk hip. So we have in the hip, we have the acetabulum, which is on the pelvis, which creates the socket, and we have the femoral head, which create on the femur, which creates the ball part of the ball and socket joint like this. So when we think about the hip, and we think about it like on a normal person and how they're walking, this is what this looks like. And so often when people come into the clinic, like when I worked in an orthopedic clinic, people would say their hip hurts. And they would always point to the outside of their hip. And if you look at what someone's hip looks like on someone and imagine them, the actual hip part right here. So when we talk about the structures that can cause like hip arthritis and things are actually going to be like in the groin, really interior and really toward the groin of the person's leg, where the outside of the hip is going to be more greater trochanter issues on the outside. It's going to have a lot to do with the musculature of the hip. And that pretty much sums up the hip, is that most of the issues we see in the hip have to do with the muscles surrounding it. So really understanding this bony anatomy, how simplistic it is, but also all the attachment points and where all these muscles are coming from will help us better understand what's going on. Because most of the things that are happening in the hip are extrinsic, outside of this hip joint. All right, so back to the hip. The acetabulum is nice and deep and thick, and the femoral head goes inside, providing a lot of stability here. It also has a labrum inside that works as a suction cup. Please make sure you're focusing on the labrum key injury spotlight to really understand what goes wrong here with the shape of the head and the shape of the acetabulum and this labrum. So then when we look at the femur, we have the greater trochanter on the outside here, and then we have our glute med and our glute min, which are our external rotators that attach here, and you have this little bursa here. You're also going to have a bursa up here by your psoas muscles up on the front of your iliac spine. Where we're going to have these high friction areas, we're going to have these fluid-filled sacs, and they can bust. So one of the key injury spotlights is a trochanteric bursitis. It's important to really understand that and read it because it's a very common problem. Okay, and so back to the hip, just understanding the hip, and I just want to point out some key areas here. So we have a lot of muscles that attach from the hip, and it's important to understand where they're coming from. So when we look at the hip, this area up here is called your ilium. And then right in here is your pubis that attaches right here. This is your pubis. And then down here is your ischium. This is your butt. So this is going to be your butt. So we're kind of positioned like this: butt, pubis, iliac spine. So when we talk about from a muscle standpoint, this outside here is your iliac spine, and it has your TFL that comes down, this big band of fascia that attaches to your IT band and goes down the outside of your leg. On the front, you have your ASIS and your AIIS. So your anterior iliac spine, so you have superior and inferior. So right on the front where we have our superior, the hip bone that we usually can feel right here, that's our anterior superior iliac spine, and that's where our sartorius attaches and goes down the front of our leg. And then our quad muscles are attaching just inferior. If you roll your finger down from the ASIS, you'll find the AIIS right here. And then on the front, on your pubis, you're going to have your groin muscles that are going to attach here, a lot of your adductor muscles, and they're going to run down the inside of the leg. And then you'll learn about that in pathomechanics, biomechanics section, about why they're usually the weaker and the tighter ones causing us problems. And then on the back, on our butt muscle here, on our butt bone, our ischium, is going to be our hamstrings. So hamstrings are in the back on the butt, adductors on the front on the groin. The quad muscles are going to attach here at the AIIS, just the rectus femoris. The rest of the quad muscles are attaching directly on the femur, where that red part is. They're all attaching along there and going straight down, combining with the rectus femoris, attaching through the patella and down through to the tibial tubercle, and then the outside big band of tissue, their TFL, attaching from the iliac crest. If you have any questions about this, please reach out.